Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. Yes, that's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yep.
Yes.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever. We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi, I'm Ashley Ballantyne. I am one of the clinical fellows of chronic pain management here at USC. So we have 3 fellows per year, and we actually only have 5 attendings within our program. It's a very intimate group, which is actually, I think, very beneficial. It allows a lot of flexibility and kind of close learning. Everyone's pretty much available to discuss cases with, things of that nature, and just a very collective group. The multidisciplinary approach that we have is twofold. On one end, in terms of the care that we provide to patients, we have a multidisciplinary approach that includes other therapists, physical therapists, occupational therapists, as well as psychologists, and then all of these groups actually specialize in pain. In addition to that, we have fellows who come from all kinds of backgrounds. We've had fellows from emergency medicine, neurology, anesthesia, psychiatry, and PM&R. So that's actually really beneficial in that each fellow brings something different in terms of their background and their training to the program, and we're able to kind of learn from each other as well as with the attendings. In terms of our multidisciplinary teams, as far as the psychologists, PT, and OT, that's actually really good, as well as we generally have monthly meetings to discuss our mutual patients and kind of go over their overall care. And we have a strong referral base between all of us in which we refer to them and they also refer to us. We all are under the pain department essentially, but each one has their own kind of subcategory as far as like physical therapy, occupational therapy, and then psychology. Over on the county side, we had a county clinic for chronic pain years ago. Unfortunately, it did close down, but now we are actually reopening that clinic and should be starting hopefully this fall. I'd anticipate that it'll probably be fully functioning by early spring, we'll say, of next year. But that actually is a really, really beneficial program that we'll be starting over there, as a lot of our patients, particularly in the LA area, will be able to provide that care for them. And the population there is one in which it's much needed in terms of chronic pain. So being able to do that is actually tremendous. We do see a lot of complex patients. Oftentimes other physicians or hospitals will refer their patients to us for higher level of care, and it's really because of the research we're able to do here, the novel therapies we're able to do here, and then also our close, we're able to easily refer patients to other specialties where they can be seen here. And again, we see rare things, so just having that experience is excellent. We recently just obtained our first fluoroscopy machine in our clinic. So that's a big deal because for a lot of patients, we're now able to just do procedures the same day, as opposed to them having to wait weeks and sometimes months for their scheduled procedure to be done at our outpatient center at Norris. So now they can come in, see us for our office visit, and that same day we can do a procedure for them. So basically it's an X-ray machine that we use to do our procedures essentially. USC is actually a big proponent of the use of ketamine. That drug is one of the more novel therapies being used for chronic pain, particularly for neuropathic and nociceptive pain. And we use it a lot here. And I think having that familiarity with the drug itself is actually very beneficial in training. And in terms of our use, we use it both as an oral medication, so people can take it outpatient, kind of with their usual regimen, or we actually have the availability of an intravenous infusion therapy that we can do. So one additional benefit in terms of the IV therapy with the ketamine is our center is actually one of the only that will take insurance. So patients are not having to pay out of pocket for this therapy that can cost them thousands of dollars, but instead insurance approval is achieved and patients can get that therapy here with us. Ketamine is a drug that typically we use it for sedation or pain. In anesthesia, it's generally for sedation or analgesia when we're doing procedures. In terms of the chronic pain, we use it for a treatment of our neuropathic pain patients, particularly those in which they are refractory to other treatments. So it is something that For a lot of patients, many other things will not work, but this will work for them. Los Angeles is a great city. I'm actually a transplant here. I'm not from here, but I do love it since being here. I think a few of the unique things about it is definitely the cultural experience that you can get here. There are many, many cultures here that you can experience. In addition to that, I think it's beautiful that you're able to either do the beach or the mountains, kind of whatever your feel is, whatever you're comfortable with, or just whatever you desire for that day. Definitely easy accessibility to all of these things. The fellowship year is a little bit better, a little bit more relaxed. Typically, you go to the clinic about 8:30, 9, and then your day is typically over about 5 p.m. And then the weekends we actually are off, so that's actually kind of nice in which you're able to kind of enjoy those things. Generally, it'll be like hikes, even going to the beaches. I love the food scene, so a lot of restaurants, dining. Pain it's a complicated, I'll say, sensation for a lot of people. It comes in many different forms in terms of what you actually feel and what we deem as the quality of pain, like what your quality of pain may be. The timing of pain, it's never something that's really predictable for patients. And I think those two things kind of make it very hard in terms of dealing with, particularly for the patient. I think also in speaking with patients in which they are suffering from this condition or having this condition, it's often difficult for them to even describe or be able to tell us exactly what they're experiencing, exactly what they're feeling, which again makes it hard for them on their end, but then also difficult sometimes for us to really be able to assess and see what exactly is going on. When you start to hear these things consistently and seeing multiple patients, whether it's with the same condition or something different, you do notice some sort of a pattern or a trend between things. Obviously, a lot of this is something that is researched and studied, so that also helps in terms of guidance of being able to treat a patient. So I will actually be staying here and joining the faculty, and I will be going back to doing general anesthesia in addition to chronic pain. So I will be doing both, which I am very excited about. Most people will go into more of a private practice setting. Some will stay academic as well, but focusing on the chronic pain side. A lot of that is variable in what your previous background is. Like currently I have my co-fellow who is PM&R trained, so she will be at a rehab location. So that's something that's a little bit different as opposed to what I will be doing. My third co-fellow was actually trained in neurology, so he's actually going to be going to a private practice that focuses solely on chronic pain. So chronic pain for me actually was an interest from when I was in med school, actually. I did a rotation back then, and it was with an anesthesiologist who did both anesthesia and chronic pain. And more or less, it was really just working with that person, seeing kind of what their lifestyle was like, and the variability between their work is what drew me into it. So I like the balance of being able to do chronic pain, seeing patients, being in the clinic. I enjoyed that type of medicine, but I also enjoyed being in the operating room. So for me, obviously the operating room was kind of my first calling, we'll say, as I did do my background in anesthesia. And then after about 2 years of training is when we kind of start doing our subspecialty rotations, in which I was able to do chronic pain here again as a rotation. And I really just enjoyed being back in the clinic is what I realized, and having that relationship with patients, talking with patients, and really helping them through what for many people is a very difficult time.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.